Aspen Green. I'm a certified nurse midwife in Austin, Texas. My start with OBHG was pretty serendipitous. I was already working at St. David's in one of the private practices, and I wasn't looking for a different job, but the opportunity to work with OBHG doctors presented itself, so I took it. At the time, St. David's was a 1.0 program, so the physicians were just only by themselves on for the whole 24 hours, so they were really relieved to have my help. And it was a great move for my career because I was still a pretty new midwife and I was able to learn a lot in a short period of time with the volume that we have at St. David's. I have been lucky enough to work alongside a lot of doctors at this point, and overall, it's been a great experience. I've been able to learn so much from the men and women that I've worked with, many things I still incorporate into my practice now. I find it particularly rewarding to work seamlessly, step by step, alongside a doctor, even maybe somebody I just met in the midst of an emergency, and have a good outcome. I didn't even plan to be a working mom. Well, let me rephrase that because we know that all moms are working. But I did not see myself being employed, especially in a full-time capacity while raising young children. And OBHG really has given me the opportunity to do that. 10 years is a long time. I have birthed 3 of my 4 children while employed by OBHG, and I was able to take 12 weeks off after each of my births. I don't post things on social media about work very frequently, but I'll read you this entry that I posted on May 30th, 2021. I posted this alongside the picture of the sign that was on the door to our midwife call room. I said, "Something exciting has happened at St. David's Medical Center. Both the company I work for, OBHG, and the hospital administration has agreed that midwives should be here caring for women 24/7, and now our contract reflects that. Since the first baby caught by a CNM at this hospital in 2015, that was me, it's been over 6 years of working hard, spreading awareness, and most importantly, gaining trust. The weight of all that used to fall squarely on my shoulders, but over time, our midwife team has grown, and I'm so grateful to work with 6 dedicated, outstanding midwives who are raising the bar for maternity care in the hospital." So yeah, I mean, it's emotional to read that because I still remember how hard we worked to prove that we were valuable there every single hour of every single day. And now we are there more than 24 hours a day. So it's a big deal. First of all, midwifery has been a calling for me. If you met me when I was in school, even at the grocery store, I might have struck up a conversation about my views on birth. At one point, I think my husband had to tell me maternal mortality rate is not the best talking point at the party. So for me, it's a passion. But secondly, my nurse midwife colleagues are a huge reason I keep coming back. These women are excellent providers and just all around quality people. And it's a joy to work with such a bright, high achieving team. We, take care of each other. If somebody needs some time off to care for a family member or go to a special event, we swap and we make it work. So I never really have to miss anything huge. And lastly, I would say that the variation of pathology that we encounter at St. David's over the years has kept my mind engaged and stimulated. Because St. David's is the maternal neonatal transport hub for the city, we are privileged to take care of some of the sickest of the sick patients. And it's always something new. Every shift provides a different experience, and I really love the diversity of that. I don't know if there's another profession more riddled with misconceptions than midwifery. I think probably the biggest misconception that I see is the distinction between a nurse midwife and a professional or a lay midwife. A nurse midwife, as implied by the name, a nurse first. So someone who obtained their RN and then goes back for their graduate degree specializing in midwifery. A nurse midwife can have hospital privileges, can prescribe medications. In some ways, the laws and bodies that govern nurse midwives are actually more restrictive than the laws that govern the professional midwife, but it actually varies state to state. So for a new CNM or OBHG clinician, I would say give it 2 years. That's the advice I received right out of school as a new nurse. And it did. It took about 2 years of working full-time in labor and delivery before I didn't feel like an imposter. And then, of course, when I became a midwife, I went from expert to novice again, and it took about 2 years. I think, trusting in your degree, trusting in your education, more than you think you do, and then just sticking with it.